And doing a little countdown before we broadcast. 3, 2, 1.
Hello, everybody who is there so far. I want to welcome you. Before I do an introduction, I want to give a few more people a chance to join us. We're currently at about 5, 6 people, 6 including myself. So if you can be patient for another minute or so, I'll get started at this point. All right. Well, welcome everyone to this short webinar on the Master of Health Communication, where I would like to explain to you what this degree is about and what you can gain from it. My name is Olaf Werder. I am the degree director of this program. It is one of 5 master's degrees offered in the Department of Media and Communication. And it, as of late, of course, health communication, or the communication of health itself, has become a quite critical thing to master in our global pandemic, with a mixture of successes and failures. If you walk around the world and look at how the governments and the health entities have dealt with it, that's really not exclusively all that health communication is involved with. Like the subheading suggests, health communication is also there to provide equity. Everybody can participate in their health and the community health, and it wants to provide some sort of inclusiveness in which you have some control over your health, while you can also trust the health system, your doctors and hospitals and other and ancillary services to provide the best care possible. So let me guide you through a couple of ideas here of how this would look like. And given the shortness of time, I'm not probably going to get through some of the ancillary things I have put on the PowerPoint, such as videos and links and so on. But feel free to contact me and you can get access to those. Towards the end, I will also explain just a little bit of how this program is structured, but there is also a little bit of a video for that. So let me get started. What is health communication? Now, I get this question a lot, even when we run local open days and people come to the table and they see the sign above and they say, well, what is it? Is it not public health? Can I not just study public health? And that's not quite the same thing, really. If you're looking at one of the definitions, which comes from one of the scholars in the field, her name is Renata Schiavo, she says it's a multifaceted, multidisciplinary, and that's a very important thing to know, it's multidisciplinary approach to improve health outcomes via information sharing, education on the one side, and attempts to modify some behavior. And there's a little bit more I want to say about this, but what I would like for you to take away from this at this point is that in this degree, I put a very big emphasis on the second word of the title. It's not to say that we leave the field of health, but people who are health communicators need to be good at communicating. And that, I would argue, is something that health entities and those working even in preventative public health units haven't mastered as well as they could, let alone all these other groups involved in this, which is non-government groups, political actors, and so on. I want to show you this little video. I hope it plays decently well, and I might stop it throughout a little bit. If the sound is not so great, I apologize in advance.
It became an instant hit, and some industry insiders are saying it's the best anti-smoking ad ever made.
Every time that we launch, particularly the media, the TV, the ads, the number of calls are highly up. Particularly the last one that everyone knows worldwide, it's increased 40% of number of calls.
So this video, this anti-smoking campaign, which was one of the best ones made, illustrates quite well how important good communication is. Although you might say, well, this is just, your average TV spot, so they shot a spot and then they put it on TV and it ran. But the content, the way it was produced, the inside knowledge that was gained, and the communicative skills, understanding people's psychology, and so on, was put to work quite elegantly. So when we look about skills in health communication, and this is why I said there is particular emphasis for those who actually want to be communicators in health, which is a special skill, is you have to both have a particular attitude and disposition towards this practice, not unlike somebody who works in commercial communication, advertising, PR, but you also have to have a fine sense for the attitudes and dispositions of those that you talk to. That's quite relevant. Since things change very dramatically and quickly, sometimes you have to be flexible and adaptable. If you just go a few months back, nobody much around the world outside China was talking about, COVID. And within a very short amount of time, it became a global problem. And so every health entity around the world had to come up with a solution for it that would both preserve or regain people's health, but also do not impact the country economically, socially too much. So, and there is, like I said, there is good and bad examples for this around the world. You have to have a bit of a confidence in yourself when you do communicate. Communicators are sort of outgoing people that also want to make connections, and for that you also have to be a good listener. And then the performance and contribution matters. And what I mean by this is not just your performance in the workforce in that line of work, but also the contribution that you allow those that you talk to make. I'll come back to that in just a little bit. The simple idea is, people will ask themselves, do we trust others according to the attitude they have towards us? That is a two-edged sword, actually, because sometimes those who produce health messages don't have an openness towards their audience. But more often it's the audience members who do not comply with the message because they feel that people don't really care about me otherwise. And there's plenty of examples, especially in sort of indigenous health advertising, developing world advertising, and so on. So how far can we go with the trust is a big issue. And I think this is also an open avenue at this point because it hasn't been developed as much as it could. So like I said before, understanding health communication is about understanding communication. And so I want to spend a few moments on that and explain to you what that actually means. Communication happens, the behavior in communication, so the listening and the talking, happens on three particular spheres. And this is especially true for expert communication. Health belongs to that field because medicine and health is a particular scientific topic that off the cuff, not everybody understands equally well. These multiple discourses are relevant for behavior patterns displayed after communication in health has occurred. So, of course, there is the expert discourse. And what that means is, I mean, on the one side, of course, your doctor saying something, you know, the doctor in a hospital that you or your family member attend is saying something, the health insurance guy is saying something. So it's basically a top-down approach. That's one line of interaction. The second one is societal discourse, which basically includes, first and foremost, the media. We'll spend quite a bit of time in this degree to understand how health information and health discourse happens through media, both news and entertainment media. And there could be, of course, just a medium, like their name suggests, so they transport the news from the expert to the audience. But oftentimes they create their own discourse in which either a problem becomes bigger than it really is, or it becomes smaller than it really is, depending on who the media are. And we have to actually spend a sufficient amount of time with understanding media and social discourse, simply because there are different kinds of media. So you, of course, have the legacy media, traditional media like television and newspapers. But of course, for the past couple of decade or so, we also have a large plethora of social and digital media who have also a discourse and create certain dialogues and certain belief patterns in people. So this is not just true for political and environmental news where there's different positions, but this also happens in health. And, you know, the refusal to vaccinate would be one example here that comes out of this particular line of discourse. Now, the last one is the lay discourse. And if you ever talked about health with a friend or family member, you know what that means. It's basically a mate talking to a mate, or a friend to a friend, or a neighbor to a neighbor. So we shouldn't underestimate that, because people do tend to believe people they know or people they live with to a certain extent, and sometimes more so than a health entity who released a TV spot on a particular issue. I'll give you an example. Here in Australia, we have quite a bit of sun, so, you know, skin cancer is a bit of a problem because people go out, they don't use sunscreen. And the Cancer Council Australia releases every year warnings. These campaigns about, which we have a campaign called Slip, Slop, Slap. Put on the sunscreen, put on a hat, put on shades, wear clothes, go into the shade in the middle of the day. But if you live near the beach and all your friends, hang out at the beach without using sunscreen, there is a huge influence that comes through that discourse. What has been true in most of public communication, so public communication means communication where a public entity, government, non-government, is involved in, but that includes, of course, health. Too little attention, according to Kirkwood and Brown, has been paid to all these other processes that exist and create certain belief patterns within audiences and people in general. When we do health communication efforts practically these days, so you have started working for a government or non-government group, most of the time, because I would assume that if you are working in this sector, you do a lot of mediated marketing prevention efforts, that the emphasis is on micro level communication things. So, if you have to make a TV spot, you try to make it good. That the lighting is right, that the actors play their part right, that it's maybe memorable or amusing or sad or fear-inducing or something. That's not bad, but you do actually need to worry about these other things too. So we're working on a completely different sphere here that is relevant. Now that gets me, of course, to something that I need to mention briefly, because this is a famous diagram or model that the communication discipline at large has been using for a long time. Ironically, it's been created by two people who were actually, I think they were engineers or mathematicians, and their purpose when they did it in the early 60s was to figure out how a telephone works. So what happens to when I talk into the telephone, and what happens to my voice. And so this language that they have coined in these boxes has actually been usurped by communication scholars at large to metaphorically make sense of how communication happens. And it has become quite popular, has been known as a communication loop. Now, I argue that in most instances, this idea of a loop is a make-believe idea, because that large arrow called feedback isn't often happening, especially not in public health. So what it actually says is, if I'm the sender, so I'm the national government, the health department, I want to make a message about how to prevent obesity or reduce smoking in adolescents or something, I got to figure out how to do that. So I create a message of some sort. Let's say it's a TV campaign or a videoed message, and I have to encode it. So I have to basically figure out a way of how my idea becomes an actual product. So a video spot. I then have to figure out how do I get it to people. So I need to pick the right media or channels. And then people have to decode it. Now, what comes into play here, which is the metaphorical and really important idea, is that my message has an intent. It's not just that I tell people something, like I say, well, it is now, here, at least in Australia, like 5:15, which is good, but I don't want you to do something as a result. Now, if I talk about smoking prevention, obesity prevention, I would like for you to do something. So my message ends on some either warning or nudging or a suggestion of what you should do now or should not do any longer. And if you actually get to that same outcome, that same thing of doing or not doing something, has a lot to do with how you decode this message. Is your brain working the same way like my brain works when I make this message? Do you follow the same thought patterns? Not just cognitively, it's not just about understanding it, but also motivationally. Are you motivated by this message, which I found, of course, when I made it, extremely motivating. But are you finding it as motivating, and will you actually follow this message? And keep in mind, there's two other factors. I first of all said, look, that feedback, which of course here would be your behavior will change. And you will stop smoking, and you will eat well, and you will exercise, or whatever it might be. But I really only have that as a measurement. And even that is hard to measure, because I don't know whether you did this because of my message or because of something else that happened in your life. But if you didn't do it, I don't have any feedback at all, other than measuring nothing happening, which is very vague. So feedback usually happens if somebody is encouraged to give feedback. In most health, it's not. I just want you to do it. And keep in mind that, like any communication, including commercial communication, there is noise in a channel. What does that mean? Now, for every obesity prevention ad I make, which has a certain agenda of what I want you to do or not do, there is other people out in the marketplace. Either they're promoting a different kind of diet or obesity prevention something, or the total opposite. You know, I always said, you know, for every diet ad, there's a McDonald's. So there is a particular different message in the marketplace. And if you believe, like I do, that communication is not just what happens in the media, but these three spheres, then of course you can expect that there's quite a lot of noise in there. Now, my biggest contention with this whole idea in large is, of course, that communication, the origin of the word, means to share, to make common, to make sense together. And current health communication isn't like that. It's unidirectional. It actually ends at that line from sender to receiver. That's it. So this participatory element is missing, and that should not be the case, really, in good communication. And that's what I say when I say, is there something missing? It will play a role in our debates in this degree, especially in one of the units. So I won't have time to show you this link, but public health campaigns, they take health message and they make it palatable. I already explained that. We have to understand, though, that health, unlike, you know, a campaign for, I don't know, clothing or fashion or cars, are complex messages. You know, cancer, for instance, is a complex disease, which most people don't understand the details of. So is obesity. You know, we say obesity leads to diseases, but do we know which ones? Does everybody suffer from the same, what's called comorbidities? So diseases that will eventually happen as a result of a certain lifestyle. And these particular links here, which I invite you to go to, try two very different approaches to explain obesity and why it is important that you actually avoid it. What you also can see in those, and I'm sorry I couldn't show you those, but is that a lot of health campaigns try to create a cause-effect situation. So this leads to this. In a world of complexity, it's not that black and white. That's a problem because people cannot see the same cause-effect connection. And another approach, and that's very much the case if you use sort of fear-based or guilt-based approaches, is they try to find blame for somebody, you know. So if your child's obese, then you might be a bad parent and you should stop that. If you're taking drugs, maybe you're swinging with the wrong crowd, or you are the one who, you know, is doing that to others, and the list goes on and on. Or it is basically an obesogenic environment. So basically our whole neighborhood is corrupt in the sense of we're not really exercising enough. My question here is, and this is a question we discuss quite a bit in this degree, is, you know, do we need a clear cause to have a clear solution? That's not always important, that we need to precisely have this very detailed link in our solution finding, as long as we work on an improvement. So I'll briefly talk about two key problems that prevent effective health communication. And again, keep in mind, they will be laid out in large detail in this degree. One is, of course, resistance. It's a group of scholars in the UK in the early 2000s have coined it. It's actually based on a reactance, a psychological phenomenon that a father-daughter team in the US called Brem and Brem have developed. It's this idea of what we also know as boomerang effect, that I intend to do something and the opposite happens, or it comes back at me. Now, the reason for health resistance, they're complex in themselves, but they can be whittled down to two main phenomena. One is that I like to be that a receiver of a health message feels that I'm my own agent of my own health, so I'm responsible for my own health. I don't need you to tell me how to live my life and what to do behaviorally. That's one. And connected to that, but it's in its own field, is a particular skepticism towards either science, so the medical science here, and a government in charge of it. So there's a trust a lack of trust in authority. And we'll see that play out in the political field quite a bit around the world. Like some people who said now argue that the US campaign was rigged because their guy didn't win. And so that does happen in medical field too. And like, for instance, the anti-vaxxer, anti-vaccination movement has two of those things in them. It's a little more complicated than this, and it's based on some debunked science, but it led to the idea that there is something the government wants, and those who make vaccines, they just want to make money. So there's a lot of things that can lead to resistance. The other element of demotivation to comply with the health message has to do with the lack of understanding that people's behavior isn't entirely based on rational thought. When you think about the theories that underpin most efforts, they're coming from the world of cognitive psychology. So basically, I think through my action, and then once I come up with the best possible action, I'll act accordingly. But it's not true that we live this way. We use our conscious mind about 10% of the time, and the rest of the time, we basically use our subconscious mind, or we use what's known as emotions, feelings, habits, because we've always done things in a certain way, intuition, because it feels right, or our creativity. And we have to sort of unravel this quite a lot. And there have been books written on this, not so much in just health, but ideas about, like, Daniel Kahneman is a big writer on, like, thinking fast and slow. A New York Times column contributor has written a book on the power of habit. And they're really important to understand because health behaviors are often habitual. So that gets me briefly to, what would the digital technologies actually contribute here? Because we've talked so much about, we seek out our social environment more and more in that sphere. And by and large, there is a bit of an appeal of digital media. So when we have these classes in the degree, and we always then discuss, like, what's a good way to communicate? And I get a lot about, well, we just use, digital media, social media, they're great. Because they're interactive. And yes, we cannot deny an interactivity. Is it a true interactivity? There's a bit of a debate about, how interactive Facebook and Twitter really are, but they are more personalized. Clearly, because they have been ubiquitously used by more and more and more people over the last couple of years, there's a large reach that you can get with digital media or social media. They're called social media because, on the face of it, they connect people socially as an extension of physical interaction that you have, in person, and that has become really important in this day and age of the pandemic, where this is blocked. And of course, ideas in social media are not sort of linear and slow, but they sort of advance. What they advance slowly in. Or non-linear, which is called viral, so they go everywhere. So that's a good thing. On the flip side, is there really a benefit? And I'm talking about a benefit of government and non-government entities using Facebook, for instance. There is a particular passivity in which they're used, so it's an info dump. So I put my message that is already on my website also on my Facebook page, and then it sort of sits there. That's a problem, because if you want interactivity, you have to be interactive. That's one thing. And if we think about the vaster target of most health efforts, so people whose lifestyle would benefit from changes, are they the most digitally literate? Do they have the disposable income to purchase the hardware that is required to use social media? And is the content really used by those people? Are they not using social media for other things and not health discussion? I jokingly always say in the class, when was the last time, you befriended on Facebook, your local or national health department? Most people don't know that they even have a Facebook page or a Twitter feed or even an Instagram thing or whatever it might be in whatever country. So what I'm trying to say is what's in one's bullet point here. There's a bit of a mismatch between the heavy users of social and digital media and those that are most in need of digital contact by a health entity or by health communicators. And the little sidearm to this is your doctor participating in this, or your hospital, or your medical practice in the city? Because I just recently I saw my GP again for an annual checkup, and yes, they now have actually an app where you can sort of confirm your appointment through this app, and so that message gets created like this. And some others have started using SMS messages for confirmation of appointments. And so there is a bit of more where actually the actual actors in health, so doctors and nurses and so on, where they use it more. But usually in prevention especially, which includes them a little less, there is not this same participation. It's also usually you see your doctor for care in prevention. So when you do not need it yet, but you will soon, because your behavior is such that you might get sick of because you act in a certain way, like you smoke, you eat the wrong food. Your doctor won't talk about that because you didn't come to him for that very reason. So what I'm trying to say is effective communication needs to consider what's known as the 4 C's. There's a couple of other definitions and explanations of this, which is you have to concern for those that you interact with. You have to build a connection. And once you build it, which is the trust idea that I talked about, then you have to actually collaborate ongoingly, which is not often done. And you have to build community, a health community that could be our neighborhood, our city, our street, or maybe even our country, which of course is a huge, sort of pipe dream that, we hope that this could happen. But it is nonetheless relevant and an important criterion to go to. So what I would do, and look, I looked at my watch, don't have time for this, but if this were a real class, we would basically now engage in an exercise. And that could be either we do it in a classroom, or if it is a distance education unit, we would do it through Zoom. So we would break out into groups and we would talk about it. So in this exercise, it's called obesity prevention. You would basically, you get some sort of guidance, some sort of ideas of what you actually should do in your small group, and then come back to the large group and present your idea and defend your idea, and also withstand any sort of critique from either me or other groups. And so it should be solid. So this idea, because you're not an expert and you don't need to read tons of things, it's sort of ad hoc exercises, which is meant to train your thinking about how can you actually look at people through their own eyes. So these ideas that you would be given, for instance, would be, what actual behavior do you want? It has to be small enough. It's not like, stop being obese. I mean, how do I do it? So you need to define it like this. You have to come up with a subgroup, a particular reason that this actually works for them, that might motivate them. You have to analyze this problem a little bit. So using relevant theories and models, best practices, if they do exist. Profile an audience more, also psychologically, not just demographically. Then segment them, and you can have certain levels of this. Have very clear goals and very clear ideas of how you want to achieve these goals, meaning very clear strategies and concepts. And also need to consider, once you're done and this is over, how would you evaluate what actually happened now? If anything came about in your with your idea. And when I say build a communication intervention or exercise, this does not mean you have to stick it on the media. Of course, this sounds and looks like your standard marketing 101, which for many people means that has to be clearly, a mediated effort. And I would argue with you, no, you can use the same lineup of these 5 discussion topics. If you would have made the decision that you just want to train doctors to talk to their patients better, or you wanted to have a community involvement, they still hold, because you still need to know these things. And you would have other partners, of course, now to communicate them properly. So since I've talked a little bit about the essence of how I envision health communication to be, and mind you, I'm not alone with this. There's quite a lot of scholars in health communication, even more in the US, Canada, and some parts of the UK, that actually are developing these thoughts, which comes far less from public health, health sciences, and far more from communication, sociology, social sciences. So effective communication is the end result of why people would study health communication. So making communication more relevant, as I write here. Communication for public health, or health communication as it's known, is still fairly unique in Australia, but it is a growing field. It draws from multiple disciplines. I mentioned a few already. Some others would be, of course, the health sciences, and there's quite a lot of electives that are still in public health. Policy or political sciences, sociology, anthropology, even the arts and humanities disciplines contribute to this, because there is an old saying that if you don't understand your history, you will not have a future. Well, that's true for health efforts too. Repeating the same message over and over, hoping for a different outcome because you're talking to a different generation of people, is frankly ridiculous. You will have to understand that your past effort didn't work and you have to change it, but then you have to understand how to change it. Good communication also masters to convey complex situations and relationships into understandable blocks, so that people can actually not only understand it cognitively, so which builds their literacy skills in health, but that they also motivationally feel spoken to. So they feel involved and engaged. And this actually then instills participation and integration. This is a very key point for me. It is as much relevant in education, mind you, I think. A good education course, and this is why we built this degree, not just as me talking or the teachers talking to the students and you write it all down and then you do an exam and you go home, but you develop the learning together. Because if you grow up like this, you will execute it as a professional in a similar fashion, at least that's my hope, so that you will talk with people, to people, and build solutions together. And that then integrates these contrasting research paradigms. You can understand, of course, that the humanities discipline uses a very different paradigm in how they get to an answer than a hard science would. But blending them, building triangulated solutions is really important for good communicative messages and how people might interpret things. So what it actually ultimately tries to achieve, good, effective health communication, is to bring alive the definition, the etymological definition of the word communication, which I told you a few slides ago means to share, making sense together. So the sharing of meaning in human communication, and I could spend another 2 hours in talking about human communication, is very important for health, because health is it's a very personal, but also quite a communal thing. And if the pandemic has told us anything from that perspective of health communication, it's those two aspects are really, really relevant equally. So what then that means in terms of the importance for these determined behaviors, so this would be another discussion that we would have in a particular part of the degree, is people have a need for autonomy, and this transcends, of course, the issue of health. But the idea of, I just don't follow people. I want to participate, the idea of translating, and I mean metaphorically translating, not language translation, but understanding translation. What that means for me in my situation is relevant. There's a need for competency. So I need to feel that what I say and what I do matters to others and is respected by others. And so that only happens when I can participate in things. And last but not least, there needs to be a relatedness, so that I feel connected to others, that I'm not just out there by myself trying to resolve huge problems all by myself, but there's others that do it with me, and I can help and they can help. So this respect, belonging from value to others plays a role. Now, for those of you who are skilled in the evolution of psychology, you will recognize this is going back to Maslow's human psychology, which is known as the hierarchy of needs. And I think there's quite a lot to say about this when we talk about health communication. So an inclusive approach in health, to sort of wrap it up, if you will, is about understanding the process of communication. So what is communication really? And I mean any kind of communication. So don't go straight to media communications. You don't want to just study media. even now, me talking to you, or you when you're done talking to your friend or relative, is communication. You need to understand how it works. Um, Awareness of human decision making. There is a lot of different theories in sociology on social practice and why people do things in a certain way. And in health, we have barely touched it with what we call the social determinants of health. So all these other influence factors surrounding health communication effort or health intervention effort that sort of might either improve the communication or hinder it. And that then in this third one sort of repeats that idea. Good and inclusive approach pays attention to these contextual factors and also ideological factors. And I don't have time to unravel ideology in health, but you can probably appreciate that health policy is not ideology free, and it gets contested as a result of ideology. So in Australia, we're debating the sugar tax. There's a lot of pushback on that. In New York City, there was an idea of reducing, large size soda drinks. Now that was ridiculed by a lot, and so has a lot to do with ideology as much as it has to do with science. So possible directions is, if you believe with me, if I've convinced you sufficiently that self-determination, individual authority are key issues, then the missing piece in good health communication has to actually be how a message accounts for a person's individuality. Can it include it? And it means that the message needs to be created only after listening to arguments and counter-arguments. And we have to actually do this differently than your standard surveys. And the channels we are using to reach people have to also be more participatory. And that does not mean social media necessarily. So I want to end this on showing you my little promo here for the degree before we officially conclude this. All right, thanks everybody for listening. Yeah, I'll leave this up for just a few seconds. But I'm sure you can just find me on the web anyhow. I'm listed under the Miko staff, so very easy to find. This wraps up the official presentation. Well, thank you for listening, and we'll spend the remaining time for any questions you might have. I see there's a few. So the way I think we'll do that, let me first stop sharing the screen now. All right, so I'll uh, you can ask your questions in the Q&A box, and I will read them out and answer them to the best of my knowledge. So, Paul, I have two questions. What role do you think the government should play in counteracting misinformation about vaccination, or COVID misinformation in general? Yeah, very important question. I could probably spend the next 15 minutes on that question alone. So, what role the government should play is its own point. Clearly, that has to do with this aspect that if you're very interested in this part of health communication, that would be known as sort of health policy support. There is a sub-degree in public health called health policy, and we'll open up these courses to our students as electives, so they want to do it. It's a tricky situation. Different countries have done it in a different way. It gets me back, and I'll leave that there for an open discussion for when we are in this forum in the classroom or on the Zoom to debate it. Is what role should the government play in health? What's the role of government and health in a republic or a democratic environment? If you believe that health is a public good, such as many others, so for instance, safety would be, and that's why we have a police force, then the government does have a role to play in improving the health or maintaining the health of its population. How far should that go? I already mentioned the idea that there is a big pushback if there is overreach, in terms of resistance. If there is such a thing as vaccination refusal, or some weird things coming up about COVID, which if you go to the US, they were actually propagated sometimes by the government, in this case, the president, then it's a tricky scenario. Now, in this country, the government has moved to sort of like a more of a hardliner approach, but it's basically protecting other people. And that's what I would say about in terms of sort of smoking. Can the government make laws to disallow smoking? And the idea is no, really no. I mean, that's not what good democracy looks like. I can't just dictate people how they should live their life, but I can't dictate that others should not suffer because you chose a different lifestyle that might impact them, and this would be secondhand smoking. So this is what has actually happened in many countries where smokers are relegated to certain areas and cannot smoke when they're too close to others who do not smoke. Should that same happen with vaccination? Well, the Australian government has decided that if you send your unvaccinated child to a school, to a public school, then you either cannot do that or you have to pay an extra fee, because what if this child would then infect the other children despite them being vaccinated? There's a possibility that could happen. So the government plays a particular role of regulation, and so I'll leave that there. Could I elaborate on the freedom of the press may cross over with health communication? It does it at all. Perhaps not everyone is entitled to an opinion when it comes to health communication, but does it constitute censorship? Yeah, look, guys, freedom of the press. I mean, first of all, in general, I'm a big believer in this. Without freedom of the press, we wouldn't really have a lot of the checks and balances so governments would free to do whatever they choose, or certain power players, if you will. In health communication, health or medicine, I should say, in this case, is a scientific discipline. And of course, if you whittle it down to what actually happens in the human body, it follows certain laws of input-output. If I put enough nicotine in it, of course, the lungs will have to respond to it. So medically, there are certain facts that are just there. They're indisputable. That doesn't mean that everybody gets equally sick, and that doesn't mean that everybody will have cancer or AIDS or something. But there are medical facts that exist, and if a medium, either in an entertainment or in a news environment, would comment on this and use these facts, then that's okay. I mean, it doesn't really impact us. You could basically reference a certain position that someone holds with this. So if you have a very extreme position from a health entity on certain things, and there is a different way to get to the same outcome, then the press should be free to debate this. Should they be free to peddle unproven things? Now, although more often there's still traditional media that do that as well. So these are usually media with editors, so editorial staff. This does exist, but far less in health than in certain other politics. But there is a larger growing group in the sort of free-for-all digital scene of sort of, you know, the digital opinion leaders, you know, which have a huge followership and could say whatever they want, and people believe it. That's problematic. But are they still considered then the press? You know, just because you have a YouTube feed doesn't make you the press. So these are really great questions, and there is no easy answer to that in these few minutes we have. I would seriously hope that that if you are interested in this project, in this degree, that these are the questions you bring to the table, that we will have group discussions on this, because I will of course have my own opinions on this, but these are things that we need to sort of work out together to come to a good solution. Anybody else has a question? All right. If nobody else has a question, look, I hope the video, the little promo video, gave you a pretty good idea of how the degree is sort of working. In essence, there's more you can ask me about. I'm not going to go into large detail here tonight, but you have a bit of a latitude to choose your specific direction that you're mostly interested in. And this is something that I spend a great deal with people who are interested in general to sort of explain. Because it's not just one size fits all thing. And I can see from some of the questions that some people have sort of different ideas and how they want to actually work in the field. You also have a great degree of latitude of where you can work in this field. You don't have to work for the government or the largest non-government entity, like for instance the World Health Organization. Although we have graduates who have actually done exactly that. So it's a very large area, and I hope that these 45 minutes, 50 minutes have been interesting enough to you to consider seriously this. And if you have a question, like I said, please contact me, contact the staff, and they forward the information on to me. I want to thank you for your patience and attention tonight. Hope you have learned something. And with that, say goodbye, and hopefully we'll see you soon. Goodbye, everybody.